Hi, I'm Dr. Shannon Shea. I'm the Clinical Director in Developmental Services, and I'm here with Dr. Condi. He's the Medical Director at VinFin, and Maureen Kamau. She's one of the Assistant Clinical Directors. You might have seen her at your houses. And we wanted to talk to you a little bit about coronavirus and the COVID vaccine and answer some questions that you might have. But first, we wanted to thank all of you, the staff, for all the work you've been doing during the entire pandemic. It's been a stressful time. It's created a lot more work. And it's difficult on everyone without having a job where you're having to interact with people and all that kind of thing. So we really appreciate what you're going through and everything that you've done. And for all the individuals we support that are watching this, we really appreciate that you've been patient and stayed home and stayed safe and worn your masks. And we know it's hard and it's been a long time. And you've been doing a really good job. And I know you miss your friends and family and going to day program. And hopefully we'll be able to get back to something like that again, after not too much longer. But one of the ways to get there is for everybody to get this vaccine. So with that, I will give it back to Dr. Condi to give us some more information.
Thanks, Dr. Shea. I want to start with some hard facts that aren't fun to think about, but are really important in telling us why this vaccine is a great idea and everyone should get it. Right now in the United States, 350,000 people have died from COVID. You might know some of them. Someone in your family might have gotten really sick. In Massachusetts, right now, between 60 and 100 people are dying every single day from COVID. So this is a terrible illness, and it's not going to get better until enough people get vaccinated. So the good news is that we've been put near the front of the line to get vaccinated, and we ought to take advantage of that particular spot in line. Believe me, I'm hearing from a lot of people who aren't near the head of the line. When can I get vaccinated? So I know that there have been some questions asked in the past about how could this vaccine have been done so quickly? Is this a safe vaccine? And sometimes people ask that question because they know that in the past, unethical things have been done, and especially poor people and people without means and people without access to healthcare have been terribly mistreated. That did not happen here. There are a lot of people that watch this process really, really closely. There are all sorts of federal committees that are like human rights committees for VinFin watching the process, and outside experts watching the process of how the drug companies developed this vaccine. More than 70,000 people volunteered to get the vaccine during the studies that the FDA used to decide if this vaccine was safe and if it was effective. And the good news is it's really effective and it's safe. So I hope everyone will remember those things and not be too worried about getting the vaccine.
So one thing that I've heard a lot of people be concerned about is that the vaccine was made really, really fast, and that a lot of people I know say they don't want to take it until they wait and see what happens to everybody else because it was just too fast to be safe.
Well, like I said, I think that the vaccine development process certainly went really fast, which is something you can do when you have $8 billion to try and do science really quickly. That's an enormous amount of money. I wish we could throw that amount of money at a lot of other problems because we could get results really quickly as well. But like I tried to say earlier, this vaccine has gone through a lot of testing. It's clearly safe. It's clearly effective. Now, I'm sure some people have gotten bad information because there's a lot of that out there on some social media, that somehow people get hurt from the vaccine or that bad things happen. I'm aware that there's a a video of a woman who gets the vaccine and faints. But she fainted, she didn't die. Some other people do faint. And the vaccine is about as safe as anything can be.
Can you get COVID from the vaccine?
Well, that's a good question, Maureen. And the answer is no. You absolutely cannot get COVID from this vaccine. This vaccine doesn't have the entire virus in it. Now, some vaccines do have an entire virus that's been deactivated. But even those, you can't viral disease from vaccines these days at all. Back 50 years ago, the polio vaccine, some people did, but not from this vaccine. The way this vaccine works is worth talking a little bit about. Imagine there's a guy who's a robber and he wants to come to your house and steal your stuff, and he always wears the same hat. The way this vaccine works is that it shows your body the hat, just the hat. And your body says, hey, I should make some defenses about that. And those defenses are called antibodies. So the whole virus is never in your body. You can't get it from the vaccine. But the vaccine shows your body just the robber's hat. And since he always wears the hat, if it sees the hat again, it knows, hey, I'm going to put up some defenses about that bad thing that came into my body here. That's the way your immune system works.
So the hat is like the antibodies, but like the hat can't hurt you. It's just a hat, right? So the antibodies also can't hurt you or make you sick?
No, the antibodies are your body's natural defense against the virus. The antibodies are what your body needs to make in order to attack the virus and make it harmless.
Yeah, so how does the vaccine work?
Well, it's a little complicated, but like I said, the vaccine teaches your body to recognize that something that's in there, what we're calling the hat, the robber's hat, is dangerous. And your body has a natural system called the immune system that makes these things called antibodies that fight off infection. You make antibodies to bacteria, you make antibodies to viruses. So the vaccine teaches your immune system before you ever have a chance to get infected with the virus, what part of the virus, just the hat, looks like, so that when you do get exposed to the entire virus, if you're out in the community and you breathe something and there's virus in it, your body will recognize it and start fighting it. And you get 2 doses of the vaccine because the first time it recognizes something, it says, okay, that doesn't look good to me. And it does some early work. But the second time it sees the hat, that's when it really ramps up protection, because then it begins to think, hey, this stuff is really around here and I'd better be prepared.
Oh, and when can people at VinFin get the vaccine?
That's another good question. The good news is that we're basically right behind people in hospitals. Doctors and nurses in hospitals have been getting the vaccine for a few weeks now. And VinFin is right after them in line. So we're really ahead of a lot of people in line. And people ought to be very grateful for that, because I get lots of calls of people wanting to know when they can get the vaccine. So it starts January 11th for some residential programs. Only residential programs and people who work there and people who live there are currently going to get the vaccine. So not everyone at VinFin is going to get it right away, but we are way up in the front of the line.
So who gets it? Who gets it first?
Well, the first doses of vaccine for VinFin will be residential homes, the staff who work there, the clients who live in those homes, and some of the other staff who come in. So there might be relief staff, there might be agency staff, There might be nurses, program nurses who visit the homes on a regular basis. They're the group at VinFen that get the vaccine first.
So is there a way we can put a rash on the vaccine and get it sooner?
Well, I wish we could. And lots of other people wish we could. It's a slow process because it's really sort of hard to store the vaccine. The Pfizer vaccine has to be really, really cold, 100 degrees below zero. So if you put your hand in your freezer at home, that's about 3 degrees below zero. Imagine 100 degrees below zero. So the vaccine has to be kept really, really cold. The Moderna vaccine, not quite so cold, but it's not easy to move it around. It's not easy to get all the people signed up. And that process is already happening right now through CVS Pharmacy, which is the partner VinFen is working with to deliver the vaccine. But we can't make it work any faster than we're already making it work.
Does everybody get the same vaccine? Like, does nobody get to pick? So if you're rich, can you get a better vaccine than someone who doesn't have any money? Or, you know, no matter like what color you are, is everyone getting the same thing or?
Oh, that's another good question. The answer is there's only 2 types of vaccine, and there's not a rich person's vaccine and a poor person's vaccine. Doesn't matter the color of your skin, doesn't matter how much money you have, you're going to get the same vaccine. Now, there are 2 of them. So if you get the Pfizer vaccine for the first shot, and remember you need 2 shots, you're going to get the Pfizer vaccine for the second shot. If you get the Moderna vaccine for the first shot, you'll get the Moderna vaccine for the second shot.
Okay. And then, if I don't get to pick, will the vaccine make me sick? Like flu shots and stuff? People say you can get the flu from flu shots and.
Well, you can't get the flu from a flu shot, but what sometimes happens to people is that their arm gets a little sore where they got the shot, or they feel a little bit like they've got the flu. Their muscles ache a little bit. Maybe they have a slight fever. Those kinds of things can happen with any vaccine because that's a sign that your body is starting to work to recognize and defend against the vaccine itself, which is what we want the body to do. So when your body ramps up, you will feel sometimes a little bit out of sorts. You might have a slight headache. That usually doesn't last more than a day. We've had some people at VinFen who work for other places, might work in hospitals, have already been vaccinated. And we're trying to get a bunch of them together to talk about it themselves. But nobody's reported anything terribly awful from the vaccine.
And does the vaccine hurt to get?
Well, it is a shot in your arm, and it doesn't hurt because it's a pretty small needle. And people have gotten flu vaccines, and I'm betting everybody that's listening to this has gotten some shots in the past. Some people don't like them. Some people don't even feel it when they get the shot. And like I said, sometimes where you get the shot, you could feel a little sore for a day or so, and other things could happen, but it doesn't hurt to get the shot.
What if I have like diabetes or something like that? Should I not get the vaccine or will it make me worse?
It won't make you worse. And it's a really good idea to get this vaccine if you have what people call pre-existing conditions. So if you have a serious medical problem like diabetes or heart failure or high blood pressure, or you've had trouble breathing, you have asthma, or you have COPD, or lots of other things, then your risk for really having a terrible case of COVID that could kill you is much higher. Now, unfortunately, COVID has sometimes killed very young and very healthy people, and even a few children have died from it. But when you have these other bad illnesses, the vaccine doesn't make them worse, the vaccine protects you. COVID with those other illnesses can kill you.
Is it okay to be a bit scared to get a vaccine?
Sure. Lots of people are scared when they go to the doctor for a lot of stuff. And the vaccine is this new thing, and COVID is this new thing. And I've been telling you all these scary stories. Of course, it's reasonable to be scared, but it's still a lot safer to get a vaccine that stops you from getting sick than to let yourself get sick, because it's the disease itself, COVID itself, is the really scary thing.
So if I get my vaccine, do I still have to wear my mask, or can I stop?
Unfortunately, yes, you still have to wear your mask, because even if you get vaccinated, first of all, the vaccine doesn't work as soon as it goes in your arm. It takes 10 days to 2 weeks to work. And that is only partial immunity. And then you get the second shot. After that, you're probably pretty safe, but you're around a lot of other people who aren't safe. And you don't know whether the vaccine, whether they've been vaccinated or not. So it's still going to be necessary for everybody to wear their mask, keep their social distance from other people, until enough people get vaccinated. So maybe around April or May is what we're hoping some of these restrictions can be lifted.
Yeah, and just to follow up on that question, so if I get a vaccine and I know a few people have the vaccine, so can I go hugging people and go back to normal routine after the vaccine?
No, I'm sorry, you won't be able to do that yet. Like I said, it's really possible that this vaccine will be taken by enough people that by April or May, if things go smoothly, enough people will have gotten vaccinated so we won't have nearly as many restrictions. And the weather will be better and people will be outside much more often. But until then, everybody has to follow the same precautions.
So will everyone have the vaccine by April?
Well, we hope so, but it's taking longer than people thought to get it out there because it's complicated. Like I said, some things have to be really cold. Some places, not enough people sign up. And so it's going to take a while. And we're hoping that April and May are when most people have been able to get the vaccine.
So why do we need 2 doses of the vaccine?
Well, like I said, when the vaccine, the first shot says to your body, hey, look, there's this new stuff here, the hat, the thing we're calling the robber's hat. And your body makes some antibodies in a small amount at that time. But the second dose, which comes 3 or 4 weeks later, really says to your body, oh, okay, this is serious. I better really prepare for this. So the second dose is a booster shot, and people have probably gotten booster shots for lots of things. If you get vaccinated for tetanus, for example, you get another tetanus shot every few years because you still need to remind your body what that bad stuff looks like. And in this case, the second shot is when you really get to 90–95% protection.
Okay, so it sounds to me like what you're saying is if we want to get back to normal, the fastest way to do that is for everyone to get their shots when they're able to. Like when you can sign up for your vaccine to get it is the soonest we can try to get back to normal, right?
I think that's a good way to put it. We won't be back to normal in a few weeks. We hope to be back to normal in 4 or 5 months, but back to normal depends on if enough people get the vaccine, and that's what we have to hope for. So some people sometimes talk about a long, long tunnel, and way down the end of the tunnel, you can see a little bit of light. So it's still a very long tunnel, but there's a little bit of light down there that says maybe the end of the tunnel is something that you can get to.
Okay. All right, so I hope we answered most of the questions that you have. If you have any more, please get in touch with us. But we need your help as staff and individuals to make sure that you keep yourself safe and then you keep other people safe so that you don't accidentally get anybody sick or get sick yourselves. And so we can get back to doing things we enjoy, like seeing our friends and family and going to concerts and football games and all of that kind of stuff. So do you have anything to add before we wrap up?
Well, I want to thank Dr. Shea and Maureen for doing this. I think this is something that we're trying to do to help people understand as much as possible what's going on with this strange new thing, this idea of a vaccine for this new illness. It's really, really important. And I hope everyone will help by getting vaccinated as soon as they can, because that's the best way to beat this virus.